Hi, I'm Greg Hunter. Welcome to USAWatchdog.com. Today we have, well, kind of a new guest. I had him on a year or so ago. I kicked myself in the tail for that, and I should have had him on. It's Kerry Lutz of the Financial Survival Network. Kerry Lutz, thank you so much for joining us today on USAWatchdog.com.
Hey, Greg, it's always a pleasure. We go back a ways.
Well, listen, I wanted to give a little bit more of an introduction to you. I mean, you interview some of the most influential financial people in the world. You have hundreds of downloads every month. You do radio. You also podcast. You also have another radio gig that you do live stuff. You've been doing this for several years. I think you have, 8 or 9 million downloads, 8 million, somewhere in that neighborhood.
Getting up there.
And, you've kind of become a bit of an expert in the financial world as well. I mean, all these people you talk to, you end up learning something. But I want to give you some credit for something that you came up with on your own. And I'm looking at my email string. You tell me what's going on and stuff like that. And 6 months ago or so, you said, hey, the website won't work. Not the plan's bad. That's how I've been talking about that. But you nailed the website. No way it's going to work. How did you come up with that prediction 6 months ago? And then I want to get your prediction for it being fixed by the end of the month. But how did you come up with that prediction?
Well, it's a real simple matter, Greg. I've been involved in PCs since the first one came out, or the second. I had an Apple II Plus, and it's basically many of the government's legacy systems. They've never been able to upgrade them because they have a rotten track record of implementing new systems. And this ObamaCare healthcare.gov system had to check real time the IRS, immigration, Medicare, Medicaid, various state systems. It even had to go to the hippie dope-smoking Peace Corps system for some reason that I'm not quite sure of why, to figure out whether you qualified for a subsidy. And it was going to do all this, calculate what the price was of the plan that you picked, and all of this was going to be done real time for hundreds of thousands of people at any given moment. There was no way the system was ever going to work. And look, when you're working on a computer system and it's going great, you're all proud, you're bragging to everybody, look at the great work we're doing. Never heard the government utter one peep about how great the system was going. In fact, the contrary, they were in complete lockdown mode. I knew the thing was going to be an epic fail. In our Triple Lutz report on FinancialSurvivalNetwork.com, I had multiple commentaries that this is exactly what was going to happen, that hospitals wouldn't know, insurance companies wouldn't know if you had insurance or not, and that this thing was going to be total chaos. And that's what we're heading for, Greg. Total, complete chaos in healthcare.
Let me interrupt you here. Sebelius is on this past week, and Catherine Sebelius, the head of the Health and Human Services, the person who's supposed to hot show this. And she and others are now saying, well, by the November 30th, the last day of November, this computer system's going to be up and running. And you say?
Yep, I think by November 31st, it'll be up and running. You know how much chance there is of this. If it is, it'll be kind of like, QuickBooks Lite. Like, it won't do anything that they say it's going to do. It'll just take your information and give you a program, and you'll be happy to get it. It can't possibly conform to the original specs and give you those and perform all of those checks in the allotted time, because there's no way. They have to pretty much scrap the system, rebuild it from the ground up. And there's no way to get those systems to talk to each other. The government can't do it. Nobody's going to be able to do it.
Certainly not by the end of November.
No, this is months. Maybe give them 6-8 months. They'll be able to do it. By then, it's too late, because the people they need to sign up on that site, the millennials, have the attention span of a tsetse fly. They go on the site, it doesn't work, they're gone. They'll never go back again. That's the way those kids work on the internet. If the site doesn't work, you've lost them for good.
Well, these are healthy people. They need to have all these healthy people paying $150 or $200 or whatever it is they're going to pay every month, who don't need the insurance. And young people are young; they're not stupid. They're going to say, "Hey, don't you have a pre-existing condition clause? So when I get sick, can I just sign up then?" And the answer is yes. You could just pay a small fine and then sign up when you need it. I mean, isn't that going to be a disaster for the system in itself?
Of course, it's pure economics. You've incentivized bad behavior. You've given people incentives to not have insurance until they absolutely need it. Like, it's as if, Greg, they said to you, Greg, don't get homeowners insurance until you smell the fire sweeping through your house, then go buy homeowners insurance, and we'll pay off the loss then. Bad behavior and guaranteed failure. Maybe that's what they wanted, or maybe they're just stupid, or both.
Well, let's fast forward into January 2014. I know, the head of the Republican Party, I'm neither Democrat nor Republican, Priebus was on CNN, and, you would think the Republicans at this point would be like, we tried to stop it, we told you, we win, but that wasn't his tone. Priebus was sad. He was like, well, in a political situation, yeah, but this is beyond politics. I'm paraphrasing. This is a disaster for all Americans. Come January 1st, explain the disaster that apparently the Republicans are seeing, and I'm sure many Democrats are seeing as well, even though they're digging in their heels. Explain the disaster that we're going to see in January 2014.
Well, you got millions of people who supposedly were going to get to keep their health insurance if they liked it. Now, in my state, Florida alone, 300,000 people cut off from Blue Cross Blue Shield, dumped. And they're getting replacement policies anywhere from 50% to 300% more in cost, with huge deductibles, huge copays, and coinsurance, which is a new term that Americans are going to get to learn about. And they're not going to be able to afford this insurance. And for what? For a bunch of people who aren't going to sign up for this insurance, a bunch of people now who are going to be on Medicaid. Medicaid enrollments are going great in this new law. And, it's a tragedy for America. It's going to speed up the ultimate collapse that you and I have been warning about for years. And, yeah, it's a tragedy. And it's nothing that the opposition should be gloating over, because they're just as responsible for it, even though they didn't help pass this debacle. They helped bring the country to this point of collapse. So, yeah, there's nothing to be happy about.
NBC broke a story. NBC of all people. I mean, they are as far as I'm concerned, the White House basically props their feet up on them as a footstool. But they broke a story, actually, bravo for them, that said, hey, it was in writing. They knew that, a high percentage, 40 to 70% of people would lose their plans that were in that market, and that, that a lot of people would be upset. But they went ahead and said, if you have your doctor, you can keep it, which you lose your plan, you lose your doctor, big deductibles. You have your health plan, you can keep it. And that's the story, period, the end. This is a talking point. I mean, I'm paraphrasing, but the president said this over and over again, maybe up to half a dozen times in major public speeches. I mean, this was here, Mr. President, say this. How could they not know that this was not going to be the case? In a lot of cases, you weren't going to keep your doctor. In millions of cases, you weren't going to be able to keep your policy because the law made them illegal. The Democrats are saying they're just junk plans, but they're not junk plans. They're illegal plans. Am I right about that? Expound on this.
Oh, yeah, I knew this 6 months ago, which is why I've kind of gone on a doctor visiting binge, where I knew that the plan that I had was not going to conform. It didn't cover abortions, didn't cover birth control pills, didn't cover umpteen tests. So 6 months ago, I made the decision I was going to get healthier, lost weight, got off of a bunch of drugs. I was taking prescription drugs, not illegal drugs. And I said, I think I might have an ingrown toenail come January 1st. I better go get it seen now, looked at. I had a stress test. I had every single blood test that you could imagine, because I know that come January 1st, the new coverage that I have is not going to be as good as my old coverage, and therefore I better get all this stuff taken care of. So I knew it. I didn't write it, but it was out there for you to find out if you took the time to study it. And, even in spite of what they said, it was out there. And, I probably have seen 6 or 8 doctors. I'm seeing in a couple of weeks an interventional cardiologist just to figure out how to get off the remaining metabolic syndrome drugs that I'm on, because come January 1st, I want to be in as perfect health as I can be, because I don't want to have to rely on seeing doctors. I want to be divorced from the chaos that is likely to ensue. May not, maybe they'll come up with a magic fix by then, but I wouldn't count on it, and I don't think you should either.
If they don't come up with a magic fix, the chaos, describe a little of the chaos that you're predicting.
Hey, maybe it'll take you a month to see your doctor. Maybe it'll take you 3 months. Maybe you'll go to see your doctor and they'll check your insurance that you've ordered through healthcare.gov that you don't have. Maybe it'll take you a month or two to get into the hospital, and maybe you're on Medicare and the hospital checks and they say, no, we won't pay for that surgery, that hip that you wanted, or those cataracts that you want to get taken care of. Who knows? We're in the twilight zone here, Greg. There's no telling what is going to happen come January 1st. I'm not fear-mongering either. These are questions that nobody can That's what's so scary about it.
Do you think the Republicans, the Democrats are digging their heels in? They say, well, give it time. We're going to fix the website. They probably will. But can they fix the overall plan? Can they get all these millennials to start paying when they don't need it? Can they make up for all the people that didn't get involved in the healthcare.gov plan? Can they make up? Can this be pulled out? And can this be a success by the 2014 midterm elections?
Maybe if they give everybody as an inducement to sign up a free Obama phone and a free EBT card, or free something or other. But I don't see. I think in this day and age, it's different than when they implemented past Medicare, where everybody bought into it, where there were benefits for everybody who got involved.
Well, you pay for your payroll tax. Everybody on the payroll has to pay for that.
Yeah, most people are getting hurt by this, and that's the thing. A few million people are getting helped, but tens of million people are getting hurt in the form of higher premiums, higher deductibles. Even if your employer is paying for your health insurance, they're kicking off their employees from it, cutting back work weeks, all sorts of things like that. Employers have been trying to figure out how to get out of health insurance for years. They don't want to pay for it anymore, and they just don't want to be in that business anymore, and this law has given them an excuse to get out of it. And UPS dropping spousal coverage, you're just going to see more and more of that taking place. So the answer is it's too late, and this thing is going to have to take its course. Unintended consequences are going to rule the day, and you just need to be prepared. And really, it starts with you optimizing your health as best as you can. And if you're overweight, you better start losing weight now, because that's the key to improving your health. It's really that simple.
When you say run its course, do you think this will ultimately be a success, or will it ultimately fail?
It has to fail, because the problem is they never talk to any doctors and hospitals about how to do this thing, and patients. And who are the people that provide health care? It's doctors, it's nurses, it's hospitals. And without those people involved, without them explaining to you how to make this thing work and being involved in the process, it's destined for failure in the end, because they're the ones that have to make it work in the final analysis. Right?
Right.
I mean, my doctors, and I have a lot of friends who are doctors down here in Florida. It's really the leading industry, healthcare, and they are just up in arms over it. And I know a lot of people, good doctors in their 60s, who were financially taken care of, said, what do I need this garbage for? I'm retiring. Thousands of doctors have retired. You can't get them back into the system now. The toothpaste is out of the tube.
And what about the doctors that are going to say, I'm going to work, but I'm opting out of this? I can't handle I can't go out of business. I mean, aren't there? They had some poll where 44% were opting out, another 30 some odd percent, 33% were thinking about opting out in New York. And so 77 are thinking about it or are opting out of Obamacare, doctors. And then on top of it, the payment. How do you pay for all these subsidies with a ballooning federal deficit. I mean, they say, oh, hey, it went below $1 trillion this year, but according to John Williams, those are one-off accounting gimmicks, that we're really expanding what we owe by $5, $6, $7 trillion a year. Forget the cash deficit. We're huge commitments, and this is another big commitment. And now Harry Reid wants to raise taxes. When people start getting hit with all these big deductibles and higher insurance premiums, do you think the economy is also going to take a hit, not just the health care plan?
Oh, yeah, because the more money you have to spend on health care, the less you can spend on other things that you need to spend it on, whether it's housing, gasoline, and you already see the housing recovery sputtering. You're seeing retail sales taking a dive, and it's not the least bit concerned about Obamacare, because don't forget there's a 3.4% tax on investment income that's going to pay for this monstrosity. And what are we getting for it here, Greg? We're getting more people on Medicaid, which is a failed medical insurance program for the poor and for people in nursing homes. Medicaid pays most of the cost of people in nursing homes, and it pays for illegal immigrants and the poor to have babies, right? 42 or 48% of the births that take place in America now paid for by Medicaid. Isn't that wonderful?
Kerry Lutz, thank you for the stark, even though it's grim, but stark and true assessment of what you think ObamaCare is going to mean for the country from now to the end of the year and into 2014. Kerry Lutz, thank you so much for joining us on USAWatchdog.com. You have the Financial Survival Network, FSN. Thank you again, sir, for being on USAWatchdog.com.
Anytime, Greg. Thank you.